Today in the EU, why the European Union became the drug market's next big target. The European Union is increasingly in the crosshairs of international drug lords. That has led to a troubling rise in drug consumption and drug-related deaths. What is this new European market like, and how do we stop its devastating consequences? Hello and welcome. I'm your host, Giada Santana, and this is Today in the EU. When we think about drugs, most of us picture cartels operations in South America or the opioid epidemic in the United States. But it's time we update these mental scenarios.
The European Union is battling a surge in drug trafficking and drug-related crimes.
De nouveau, 110 tonnes de cocaïne, c'est quand même du jamais vu.
Just to confirm, it's getting worse throughout Europe at the moment.
In Europe, the rate of drug violence has been climbing, and so has the offer of drugs. In 2022 alone, record quantities of cocaine were seized by EU member states for a total of 323 tons. To contextualize this phenomenon, I'm first talking to Euractiv's health editor, Catherine Feore. Hi, Catherine.
Hello.
With the COVID-19 pandemic, we really saw a growth in interest for health policy. The pandemic really highlighted the critical importance of it, but yet we don't necessarily see that same interest now. Has its relevance diminished?
What we saw during the pandemic was the EU really stepping up to the plate. Health has never been a huge competency of the EU, and yet at that moment, we saw the EU come in, develop its vaccine strategy, take an approach to the whole of society questions that the pandemic raised. So we really saw health have a transformation in EU policy. Since then, it has been relegated a little in the EU's priorities. What we should have learned from this is that what is particularly important when there is an unforeseen event is that you need a very resilient society. You need a society with good public health, with a good workforce, with good science methods to develop technologies to deal with a crisis. And there have been some measures to put that in place. We have HERA, the Organisation for Health Preparedness and for Crises. But we've seen the budget decrease. We've seen people taking their eye a little bit off the ball. And that is a cause of concern.
Well, if I think of a good workforce and a resilient society, of course, tackling drug addiction becomes very important. Countries in the EU take very different approaches to it. Can you give us an overview?
We see a whole range of views. We see the approach of Portugal, where it's very supportive. It's recognising that people who are addicted to drugs need to be, instead of criminalised, helped, assisted to move on in their lives, to find work, to find purpose, to get treatment. It's a very understanding approach, and it's been seen to work. Other countries take a more punitive approach, that these people should reform and they should be punished. And I mean, there's a whole range of approaches.
And what role do investments in hospital infrastructure and the broader health system play in, favoring the success of these approaches?
For drug addiction and for drug use, I don't think it's so much a question of hospital care, but it's a question of education, health literacy, getting to those people who are in vulnerable groups or get to people who are taking drugs and educating them and informing them and also letting them know about what a treatment is available.
It's about prevention.
It's about prevention primarily. And of course, there should be support to people who are already addicted in looking at alternatives and looking at psychological support, mental health issues. And I would say the whole framework of their lives quite often, because often we're looking at people who are excluded from society, who don't have good housing, who have difficult family backgrounds. So I think it's a whole of society issue.
When we look at drug consumption and the drug market, definitely the drug racket has a unified approach to Europe. Drugs are shipped to Antwerp or to a city on the shore in Spain, and then they're distributed across Europe. But does Europe have a unified policy approach?
Europe has had a policy on drug addiction and a monitoring of drug addiction for many, many years. The European Monitoring of Drugs Agency, which recently changed its name, what it's doing and what it's trying to do more of is monitoring and sharing vital information. So, for example, we have some particular challenges at the moment with drugs that are a mixture, complex drug cocktails that people aren't familiar with. And one thing that the drug agency can do is monitor these drugs, assess them, send out warnings to the wider network across Europe, say this drug, this has arrived, it's contaminated with this particular synthetic drug, it's a mixture of cocaine and something or heroin and something, and you need to be aware that it's out there. And providing support and also providing evidence-based support to countries. I don't think the EU is ever going to tell member states how they should deal with this approach, but it can share best practice. It can say what their research has shown as interventions that work.
And to get a better sense of what that looks like in detail, we're continuing the conversation with the director of the EU Drug Monitoring Agency, Alexis Goosdeel. Hello, Alexis.
Good morning.
Let's start from your latest report. The drug market is now different than it used to be. It is wider and richer in options. There are substances that are available at a higher potency or in new forms, mixtures, and combinations. What are the causes behind this development?
Well, what we observe in the recent years is first, more availability of any kind of substances. Drugs are everywhere today, but also we have a huge increase in the quantities of drugs and substances that are produced on the territory of the EU.
And what is this due to? Is it a matter of the market being more efficient? Is that it?
I think what we observe for the moment is a huge, very dynamic market and a huge pressure from the market and from the producers to increase their customers base and to increase the quantities that are being consumed daily in Europe. So the cause of the evolution is not the demand, as some people sometimes suggest, it's more the offer, and the offer is desperately pushing to create a market.
When we talk about supply, how do drugs get to the European Union?
Well, here also we see a very important change. Before COVID, there were various ways to traffic drugs by plane, for instance. But today, what we observe is that most of the traffic is being transported through containers.
So through ports.
Yeah. So before the police or the customs, they could announce the seizure of 50 or 100 kilos of cocaine or heroin. No, we talk about seizures. The recent weeks, I think there was a seizure of more than 5 tons of cocaine. The dimension of the transportation and the impact on the ports is obviously very important.
Indeed, the European seizures now exceed those made by the United States, historically a country considered to be among the largest markets for drugs. Is Europe becoming an epicenter of drug consumption?
Well, I don't think it's yet an epicenter because the driver for the moment is the offer. The driver is the production. And it all started to change if we speak about cocaine, for instance, when the Colombian government opened the peace negotiations with the FARC. One the unexpected and unintended consequence is that it has corresponded to the moment where there has been an increase in the production of coca, an increase in the better yield in the chemical process to produce the cocaine, and at the same time, the U.S. market seems to have reached a bit of its maximum, and therefore the cocaine producers they need to find other markets to send and to sell their products. So there has been a huge move towards Europe, but also increasingly Europe is becoming a transit hub. And the end destination can be the Middle East, can be other regions of the world. So the evolution and the threat is certainly significant.
And the threat is significant also because the substances that we see now are not necessarily the ones that we used to see or that specialists are trained to take care of, especially because we're talking now about an increasing phenomenon of polydrug consumption or synthetic drug consumption. What does that mean?
Yes, you raised a few important points. I would take first the first one when we speak about how potent are the substances of today, and are they different from the substances that were circulating and being consumed 15 or 20 years ago?
Mm-hmm.
And the answer is yes, they are different. They are different because the hospital, the social workers, people working on the drug field, they observe that. Every time there is both an offer and an interest for a more concentrated, more potent substance. We see that regarding cannabis, maybe 40 years ago, 50 years ago, at the time of Woodstock, maybe the concentration of the cannabis that was consumed, the concentration in THC was maybe around 4%. Now it reaches for the marijuana that is being consumed in Europe, it's more or less 11, 12 as an average. But if you look at hashish, it can go up to 18% or 20%.
Wow.
Some of the products that are consumed today look like those who were used before, but they are much more potent, and therefore the risk for health, the risk for toxicity, the risk for overdose is really much higher.
Mm-hmm.
The other side is that there are new substances that are not yet registered or considered as drugs. This is what we call the new psychoactive substances. This means there are substances that are having an impact on the brain, an effect on the brain, like drugs or established drugs.
And according to your latest report, drug induced deaths continue climbing. What are the prevention policies in place, and what challenges are you facing in enforcing them?
So we have a good portfolio of services or prevention programs. I think the problem that we are facing today is twofold. The first is in the member states, a big part of the professionals working in prevention never had the opportunity to have an education about what are the evidence-based methods for prevention.
Mm-hmm.
The second point is that most of our prevention programs they have been designed since the 70s, 80s in Europe, which was the heroin epidemic.
That means that these prevention policies are about 45 years old. Have they been updated?
They have not only they have been updated. We continue to invest in Europe in having better scientific base for evaluation programs.
I imagine you're in contact on a regular basis with policymakers throughout the EU. What are they missing, and what should they be focusing on when they look at the problem of drug consumption?
One of the things for which in the recent year, because also of the various successive economic crises, I think we have lost a bit ground is the community. Because one problem that is more recent, it has just appeared and increased the last 6, 7 years, is drug-related violence.
Mm-hmm.
So drug-related violence today is really everywhere. It's in all the countries, and we all have a problem. Now, the fact we have all a problem, it can be expressed in different ways. The consequences locally can be different from one place to another, but we have a problem because even the mayors of the cities, they say themselves, the answer cannot be only law enforcement. Well, what it means is that through the different crises and the negative impact of the COVID pandemic, first of all, we have societies where there is less solidarity than 10 or 20 years ago. The fact that during the COVID pandemic, there was the lockdown in many countries, people are even more aggressive. But also, in many countries, community policy was cancelled. It was considered useless or too expensive. And those programs altogether are those who allow to keep the links, to keep the relationship between the people. The idea is really to work with the different professionals and decision makers to see how can we help to make our communities more resilient. But more resilient is not only about drugs or not only about drug-related violence. is the community as a whole.
Thank you, Alexis. I'm Giada Santana, and this was Euractiv's Today in the EU podcast. Visit Euractiv to stay on top of the latest news, sign up for our podcast newsletter, and if you haven't subscribed yet, you can find us on Spotify, Apple Podcasts, or wherever it is that you get your podcasts. Leave us a star review on Spotify, Apple Podcasts, or your favorite streaming platform. It will really help us spread the word about our work. This episode was produced by Miriam Sanz de Tejada, Nicoletta Yonta, and me. As part of our commitment to accuracy, inclusion, and transparency, Euractiv is part of the Trust Project.